Hey everybody, Dr. Davis here. Thank you for joining me for this video. In this first video in our series on shoulder pain, I'm going to talk about some of the most common causes of shoulder pain that I see as an orthopedic surgeon. There are four major categories that we're going to cover, and I think that will cover probably 90% of the shoulder problems that I see in my practice. The first category is the bones. Obviously a broken bone can cause pain in the shoulder. Typically we see this from someone falling and catching themselves on their hand. The pressure then goes all the way up the arm and into the shoulder and can cause a fracture. The second type of fracture that we see, or injury that we see causing fractures, is someone falling off to the side. Maybe they're holding something or they simply don't have time to react and they land directly on the side of the shoulder. And that can also cause a fracture. Now most people would think that a fractured bone, a broken bone in the shoulder is going to be very obvious from the outside. And sometimes that's true. Sometimes the bone is very crooked and it's visibly deformed from the outside. But you'd be surprised that there are quite a few fractures that we see in and around the shoulder that from the outside really don't look like much of anything. There's very little swelling, there's not much bruising, at least not initially. And sometimes just keeping your arm still at your side, the pain really isn't that bad. After a day or so you may be able to move your arm down here without it being too painful, but raising the arm out away from the side or going up the front can be very painful. So broken bones are one very common cause of shoulder pain. If you have a fall, if you have an injury of some sort, and you aren't able to raise your arm up out to the side or go overhead, even if it looks okay, if that lasts for more than a couple of days, it's probably a good idea to get an x-ray taken just to evaluate it and make sure there's not anything broken. The second major category of problems that we see that cause pain in the shoulder are problems with the joint, what most people would call arthritis. Now there are two major joints in the shoulder. The ball and socket joint is what most people think of when they think of the shoulder. The shoulder blade has kind of a cup shape to it, almost like the shape of a golf tee, and the upper end of the arm bone has a big round ball at the top, and that ball fits into that cup, and that's what makes up the ball and socket part of the shoulder. And that's what gives you most of the motion with your arm moving this way, out to the side, and up the front. As the cartilage surface in the joint can wear away, that's what we call arthritis, and that tends to cause pain, sometimes a little bit of weakness in the shoulder, and limited motion. Now one of the things that's unique about arthritis is that the pain that you get can be very similar whether you're moving the arm yourself, what we call active motion, where you're using your own muscles to move the arm, or if something else is moving your arm for you. That can be another person, or you can use some sort of external piece of equipment to move your arm. That's what we call passive motion. In physical therapy, we use a tool like this, which is an exercise bar, and we use that to help people move different body parts. So you could hold on to it like this, and even without using your left shoulder at all, you can push with the right arm and you can make the arm move. You don't need something special like this necessarily. You can use a broom handle or a mop or a cane, anything that's rigid that you can use your other arm to push with. That'll create what we call passive motion, and if that hurts just as much as this, then that would suggest the problem is in the joint itself, and that's more likely to be something like arthritis. Now there is another joint in the shoulder, what we call the AC joint, which is where the collarbone connects to the top part of your shoulder blade. You can find that joint if you put your fingers up here on your collarbone and kind of walk your way out, and there's a little soft spot right up here, and that's the AC joint. You can press on that area, and if it's very tender, that would suggest that there's a lot of inflammation in the AC joint, maybe arthritis. The other way you can test that is to compress that joint. The AC joint really doesn't move all that much when you move your arm around this way, but you can compress it by raising your arm up and bringing your arm across your body. Now you have to kind of go slow when you test this, because when you raise your arm up this way, if that already hurts, then it's probably not just your AC joint. There may be something else causing the pain. But if you can get your arm up this way and then you come across and that's when the pain gets bad, that would suggest that the AC joint is part of the problem. So that's bones and joints. The next major category of problems in the shoulder that I see as an orthopedic surgeon are problems affecting the muscles and the tendons. Technically those are two different structures, but they work together, and most of the problems that we see related to those are treated the same way, so we're going to treat them as one group. There are a lot of different muscles around the shoulder. Some of them raise your shoulders up, some of them raise your shoulders down, some of them roll them forward, some of them roll them back, some of them raise your arm out to the side, some go forward, and some rotate your shoulder. The ones that we're going to focus on today are the rotator cuff tendons. Those are kind of deep in the shoulder, so it's hard to feel them from the outside, but they are primarily responsible for the rotation movements and raising your elbow out away from the side. There are four muscles and tendons that make up the rotator cuff. One in the front, called the subscapularis. It's deep down in the shoulder, so you can't feel it, but its job is to help bring your arm in this direction. So if your hand's out in front of you and you bring it across your body without moving your elbow, that's the subscapularis that's doing that. There's two in the back that are on the shoulder blade and a little bit lower down that help you rotate your arm out this direction. So they go the opposite direction from the subscapularis. That's the teres minor and the infraspinatus. The fourth one, and the one that's probably the most commonly affected of the rotator cuff, is the supraspinatus. That sits up here on the top back part of your shoulder blade, and its job is to raise your elbow out away from your side. So when you go up this direction, the supraspinatus is the one that's doing most of that work. So by identifying different movements that hurt, you can try to isolate which one of those muscles or tendons is causing the problem. There are common everyday things that you do that you may notice cause a lot of pain, and that can help you kind of figure out which one of these is most involved. So for the subscapularis, the one in the front, the motion of putting your hand back behind your back. So for men, getting your wallet out of your pants pocket or putting a belt on, that motion requires a lot of rotation inward using the subscapularis. For women, doing their bra is a common problem with the subscapularis irritation. The other direction, external rotation, using the infraspinatus and the teres minor, go in the opposite direction. That would be something like reaching up to get a seat belt to bring it across your body, or putting your hair up, brushing your hair, or shampooing your hair. That motion requires you to turn that arm out, and that's going to be the infraspinatus probably. The last one, elevating the arm out this way, that's the supraspinatus. So anytime you're trying to put something up above shoulder level, so putting dishes in a cabinet or getting something off of the high shelf in the refrigerator, those motions are going to put stress on the supraspinatus. And that's probably the most common one that we see. There is a fifth tendon in the shoulder that runs up and down this way, called the biceps tendon. It's not technically part of the rotator cuff, but it's a frequent cause of pain in the shoulder, and sometimes the motions that irritate the biceps tendon are very similar to some of the ones that will irritate the rotator cuff. So it's hard sometimes to tell the difference between the two. You can feel the biceps tendon if you're careful. You can put your fingers across the front of your shoulder and kind of feel around with your fingertips, and there's a little groove in the front of the shoulder that sometimes you can identify. The biceps tendon runs up and down in that groove. So if you press on that area and it's very, very tender, that would indicate that the biceps tendon is pretty irritated. Now sometimes that can be the main problem, the primary problem, and sometimes that can be a secondary problem. When your shoulder's hurting and it's not working properly, you tend to compensate for it, and it's easy to get that biceps tendon to do more than its fair share, and then it gets irritated and inflamed. So sometimes it can be more than one problem at once. The fourth category that can cause shoulder pain are nerve problems. The nerves are like the wiring in your body, so they carry signals back and forth from your brain out to the different body parts and then back to the brain. And in orthopedics, one of the problems that we see frequently with nerves is compression, something pressing on and irritating a nerve. A good analogy for that is if you were to take a garden hose and run it across your driveway and turn on the hose, turn on the water, water comes out the other end, everything's working properly. If you step on that hose, then you can slow down the flow of the water through the hose. So it's still working, but it's not working normally. If instead of stepping on it, though, you were to park your car on it, that puts a lot of pressure on the hose. It kind of shuts off the flow of the water and nothing's coming out the other side. Well, that same kind of phenomenon can happen in your body. If you have a pinched nerve in your neck, that can cause pain wherever that nerve goes. Now, pain is not always the only symptom. That's probably the most common one, but pinched nerves can also cause numbness, they can cause tingling, they can cause weakness or a burning sensation. So depending on which part of the nerve and which nerve is affected, the symptoms that you can feel may vary slightly. You would think that with a pinched nerve in the neck, most of the pain would be in your neck, but that's not always the case. I see a lot of people that come in complaining of pain over the top part of the shoulder, back around the shoulder blade, and even in the upper back between their shoulder blades. And after doing some testing, we figure out that the problem's actually in their neck. One of the ways that you can test that to try to figure out if that's really the problem is to simply move your head and neck around, and if that makes the pain worse, but moving your arm around really doesn't hurt, then that would suggest that the neck is really the problem, even though you may feel it in the shoulder. So those are the four major categories of problems that we see in the shoulder. The bones, a broken bone, the joints, arthritis in the joints, muscle and tendon problems, tendinitis or tears, and nerve problems, usually a pinched nerve. So if you can kind of pay attention to some of those different things, watch what you do over the course of the day and see if you can identify which things hurt. So that's what I would suggest. For the next few days, try to pay attention to what you do during the day that makes the pain worse. And pay attention to what you do that doesn't seem to hurt at all. And that may help you kind of nail down what this could be and eliminate some of the things that it probably isn't. In my next video, I'm going to cover some of the various treatments that we use to manage shoulder pain. And the better you understand what's causing the pain, the better you'll be able to use those tools and techniques to your advantage. So keep an eye out for that video. It'll be coming in the next few days. I hope that was helpful.